we're going to demonstrate the complete mouth care system and have you experience how it goes with Denise, who's volunteered to do this. There's no coercion here, but she's going to show you how to use the complete mouth care system, and I'm going to describe what's going on while she's doing it. Now, you can get a kit completely, or you can buy the products where you live in grocery stores, and it'll work just as well. The most important thing is you need very specific products. It's really important you get the right products and you use them in the right order. And the way you use them makes a difference too. So we're going to hope to show you that today. The first step should be timed. And Denise is using her phone as a timer. It's to do this mouth rinse Closys. And she is using the caps to dispense, not quite a full cap full. You can, if you prefer, use a cup, but a cap is fine if it's just you using the products. And with this mouth rinse, the Closys is it's a chlorine dioxide mouth rinse, which basically is being washed gently around the mouth so that it interacts with her saliva. The saliva in Denise's mouth is actually interacting with the chlorine dioxide and forming oxygen. And that oxygen is what helps get rid of the anaerobic bacteria in the mouth. If you don't rinse for a full minute, you lose some of the benefits. So make sure you're timing this. And a minute always seems longer than you think it is. And then you just spit it out. And while you're rinsing, or straight afterwards, you will pick up your toothbrush and put the toothpaste on your toothbrush. Now, Denise uses two different sizes of toothbrush. She likes to use a small one first and go to the places that are most difficult for her to get to. You don't need a lot of toothpaste, about the size of, they say, a green pea. I don't know, it looks about the size of a green pea. And she goes to all the places that she really wants to make sure look white, applying the toothpaste to her teeth. She goes all the way around to the very, very back, on the sides of all of these teeth, working around. If the smaller toothbrush is better for your mouth, if you buy these good toothbrushes that I recommend, they're just as resilient, they're just as good as the adult, bigger toothbrushes. Most toothbrushes today are too soft, and you will not achieve the kind of massage to the gums that you need with a toothbrush that is too soft. It's not about timing this. Some people say, oh, they brush for 2 minutes. It's about going everywhere on the outside of your teeth, like Denise has now gone all around the outside of her teeth, and then you want to go on the inside of your teeth. Same thing all the way around on the upper teeth and the lower teeth. And this can take time. It's more important that you do this thoroughly. And especially if you have gum disease or gum pocketing, you have to massage the gums. By massaging the gums, you are stimulating a healing response. If you're trying to get rid of gum pocketing, you need the healing response, your body's own messaging. It's a signal to stem cells to come and heal, to blood vessels to grow into the area and heal any pocketing that you have around your teeth. If you don't do adequate gum massage, you just will not keep your gums healthy. And the soft brushes that everybody are using today, they're problematic. Now, these brushes that I recommend are quite resilient. And the reason they're not damaging your teeth is because we used the pre-rinse, this Closys, this pre-brushing rinse that alkalizes your mouth. It gets rid of acidity. And you need to do something to get rid of acidity before you do this vigorous gum brushing. But it's an important thing to do. So once you've done that, you can spit out the toothpaste and then do the next step, which is a vigorous rinse with the Listerine. Doesn't have to be for long. You do it just as long as you can stand it. If that's a couple of seconds, it's fine. If you can, I don't know how long Denise can go for, but if it's just a few seconds, it's fine. Use it. The eucalyptus, menthol, and thymol in the Listerine, they target immature plaque bacteria in your saliva, and that's helpful. No, Listerine does not kill all the bacteria in your mouth. It's very targeted. It's very specific. It is an essential oil mouth rinse. And what the eucalyptus does for your gums is incredible. And because Listerine is acidic, it actually amplifies the benefits of the final mouth rinse, which she's going to use in a minute. Now, listen, in this case, Denise has done a really good job of going about 30 seconds or so with her Listerine rinse, and that's great. That's what you aspire to. And don't be concerned if you cannot go that long. Just go until it starts to feel spicy, and then spit it out. And then immediately, no mouth washing with water or anything between, you end up, this is the end of it. You're using this dilute sodium fluoride mouth rinse, 0.05. There is no alcohol, 0 alcohol in this final rinse, and you use the final rinse for the same time period that you used the Listerine. If you went short with the Listerine, go short with the Act. If you can go 30 seconds like Denise did with the Listerine, do the same 30 seconds with the Act. Match those two, and you aspire, as I say, to 30 seconds. But if you can't do that long, it's okay. At the end of the Act, when you finish doing this, and this is not quite as vigorous, it's more of a bathing your mouth, this is kind of moisturizer for your teeth. Spit out a couple of times, usually a good idea. If you want to, just spit again, spit twice, 3 times, whatever makes you comfortable. And then, if you want to, you can end with some Xylitol mints. This helps people who don't like the taste. It's also a good way to end. If you don't want to do mints, you don't have to. That is an optional ending. The mints, the Xylitol mints, can be eaten at the end of meals. They can also be used after the complete mouth care system. And some people like to eat them during the night. If they wake up and they drink water, they will have a mint then. When you've used the complete mouth care system, whether or not you've had a mint, now is the time to not eat or drink for an hour. Rest your mouth. Give it time, because at this moment, your teeth are prepped to absorb minerals from your saliva and heal. Your teeth are going to heal. They're going to be stronger. They're going to be shinier. Look at those teeth shining. And your gums are going to be healthier because the immune cells in your saliva are going to make them healthier. So this hour now is a very important time. Think of the complete mouth care system as a spa treatment and how quickly we did that and the incredible effects that you will get for doing it.